It's important to wash every single day. Now, why every day? Well, because honestly, when we go through our daily lives, what happens? We sweat, we sort of build up perspiration, we slough dead skin cells, there can be bacteria buildup and things like that. So, washing every day, first of all, I think is a really good habit to get in. But now, when it comes to what we wash, I also want you to sort of think about your genitals as sort of a group, okay? It's not just your penis. Yeah, the title of the video is How to Wash Your Penis, but you got to wash your penis and other parts too. So let me explain. Yes, you want to wash your penis, the underside of the penis, it's very important, but also your scrotum, that's your testicles, etc. And then also your anus, okay? You need to wash all of those areas. Don't leave out one, thinking it's not important, because honestly, it is important. And in addition to what I mentioned about sloughing dead skin cells and sweating and things like that, if we're not washing properly, it can predispose us to having infections and other problems, all right? Irritation, etc. Okay, so those are the areas that you want to wash. But I know you're probably saying, well, but how do I wash them? First thing I would say is you want to get a gentle or mild soap. And sometimes it's hard to tell if a soap is going to be gentle enough for you. Sometimes it's a little bit of trial and error. Some soaps on them, if you go to the drugstore, what have you, actually say mild, gentle soaps. Okay, but the idea here is we want to minimize the risk for irritation, rashes, redness, uncomfortableness, things like that. If you need recommendations for mild soaps, you can feel free to ask your doctor, etc. Maybe somebody in your household has some recommendations, okay? Now, in terms of how you wash exactly, like the nuts and bolts of it, some people say just wash with your hands with some mild soap and water. Other people, like myself, I tend to say, washcloths can be very helpful. Now, I have videos on washcloths. There is a debate on washcloths. Some people like them and some people don't. So I'm going to leave you to decide what is right for you. But whatever you use, make sure that you're consistent and that you're thorough, that you're lifting up stuff, you're moving stuff around, you're getting on the underside, you're making sure that you get your anus region, etc. Okay, areas that are hairy, and all the other areas too, with that mild soap and water. Let's talk a little bit about SMEGMA. Okay, so you might have if you're looking for videos online about how to wash your penis, you're going to come across the word SMEGMA. This is important to talk about because it's actually like sort of a cheesy-like substance that can be found really in anyone. Women too, by the way. I also have a video on how to wash your vagina, so check that out. And before I go on to SMEGMA, let me just say too, I've learned that a lot of people share my videos with kids, young people that are growing up and learning how to bathe, or even older people. So I encourage you to share this video with anyone who you think it might be helpful for, okay? And it might be basic for some people, but it's not going to be basic for other people. So hope it's helpful. SMEGMA, back to that. It's like a cheesy, whitish, yellowish substance, okay, that can, again, it can happen in women. It can also happen in men. Any man can get it. It tends to be more common in uncircumcised men. It's kind of thick. It's cheesy. What is it? It's a combination of things. It's a combination of oil from your sebaceous glands. Okay, those are glands that produce oil, which your body actually needs to happen. But it's a combination of a collection of that, dead skin cells, and sweat and other fluids and things like that. Okay. The issue with SMEGMA is that it can have a foul odor, and you really want to make sure you're cleaning this, because if you don't, it can build up. It can cause irritation. It can lead to infection. It can cause discomfort and other problems. And that's also another reason why you really want to keep your penis area clean, circumcised or uncircumcised. Remember, it can happen in anyone. SMEGMA is not an STD. It's not a sexually transmitted disease, so it's really important to keep that in mind. But yeah, it can be it can smell pretty bad. It can make a retraction of your foreskin if you're uncircumcised. It can make that difficult, painful, etc. So this is really important. And I should also go on to say, if you are uncircumcised, you need to make sure that you are pulling back the foreskin and washing properly. Okay, you've got to pull back the foreskin to make sure that you are cleaning all areas. Okay, let's see here. What else do I want to say? A couple other things to kind of keep in mind too is, let's not forget sort of our general hygiene when it comes to washing ourselves. We talk about the penis, pulling back the foreskin, underneath the penis, the testicles, the anus, etc. But you always also want to make sure that you're washing other parts, washing your belly button. Sometimes that's an area that gets lost. I have videos on the importance of washing your belly button. You can actually get infections from that. Many people who've written on my videos, belly buttons have talked about a foul odor or smell coming from their belly button or drainage. That can happen too. So you want to wash there as well, and other parts too, not just that. But you also want to make sure that you are washing your hands properly. Okay, using soap and water consistently. That's going to be very important. Good hygiene is really key to a lot of good health. So I'd like to know if this was helpful for you or for your family or anyone that you know. Write in the comments what you do. I always like to ask you guys to comment on what you do, because sometimes your habits or your suggestions or what you say helps other people. So feel free to write that. Share this video with others. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily videos. I'm on Facebook. Please like and follow my page there. And YouTube, please subscribe to my channel and click the little bell for updates. Also, I'm on TikTok and WhatsApp, and I thought I was gonna sneeze. I'm on TikTok and WhatsApp and Instagram, etc. at Dr. Jen Caudle. Please follow me there as well. And please go to my website, www.drjencaudle.com, to sign up for my free health newsletter. Guys, I hope this is helpful. Love y'all.